So how do we deal with all of this stress? So we have some coping strategies here. First would be the education of the disease process and the related behaviors. Secondly, joining a support group. Third, to conduct a practical family assessment. And fourth, to develop a plan. And then fifth, to practice positive stress reduction techniques. I'm going to talk about each one of these. Education. As we all know, knowledge is quite powerful and definitely brings a sense of control over especially a situation that can be somewhat unpredictable and not as controlled as you like. So learning about the disease itself, how does it progress, but learning the details of what's involved in that disease, whether it be dementia, congestive heart failure, diabetes. Getting that information, of course you can get that from your provider, but professional organizations, of course, also have the information to educate in terminology that's meaningful to you as a caregiver. So trying to obtain as much education as possible is important. Then again, looking at the disease course. What should you expect in this chronic disease? Most chronic diseases will have ups and downs or exacerbations that would require changes in treatment or ways of doing things. So knowing that, knowing how to identify it and knowing what to do in those situations reduces stress. It prepares you, and you have then that education of how to deal with it. As I said, the symptoms or the behaviors, knowing those are important. In dementia, for instance, knowing what kind of behaviors, what is the source of them, and then how to deal with them. What do you say when someone keeps repeating themselves or becomes agitated? Or in congestive heart failure, when someone has a sudden increase in shortness of breath, what do you do immediately in those situations? So education is our first thing to try to reduce the stress. Support groups are invaluable. Caregivers tell me all the time how important it is for them to meet with others who are going through the same thing that they are. Having that shared experience, and usually in a support group, you're going to have caregivers who are ahead of you in that progression of the disease, and then those behind you. So it's important to actually interact with both of those individuals. Having someone who actually has shared your experience, has already been through it, and can relate and provide information on how they dealt with it is important. But also, as a caregiver, you have experiences that it's important for you to share and to be able to give to others as well. So I encourage you to definitely find a support group, and I'll tell you in a minute where you can go to do that. Some coping strategies for situations and specific behaviors, that's usually what is shared in a support group. The individuals in a support group are talking about how they deal with whatever symptoms, behaviors, or their own feelings of dealing with someone who has a chronic disease that is declining over time. It can be quite educational in a support group, things that maybe as a caregiver you were not aware of, whether it be about the disease process itself, what to do in certain situations, what has worked for others, that you can put in what we call a toolkit to have a lot of different options, because not always are you going to know those options from your provider who provides the health care. It's all these other individuals who've tried things that seems to have worked for them and seems to also be helpful. And then they also, in support groups, the individuals there seem to share information about community resources in their area, what programs are out there that have been helpful to them, what for financial program, but is also as well as care individuals that they could hire to assist them for respite. So it's really important to join a support group. For those individuals who are caring for someone with dementia, the Alzheimer's Association have listed on their website, which is alz.org, their national support groups all over the nation that are available. Parkinson's disease, you can actually go in and write on the web Parkinson's support groups in Texas, for instance, and it will pull up by counties what are out there. Not only will they have support groups for caregivers, but for actually the individuals with Parkinson's disease. So you can do that with the other chronic diseases as well. But I encourage you to find a support group. Again, it's been quite effective for the caregivers that I see. The next part would be to conduct a family assessment. And I use the word family somewhat loosely. We have all sorts of family. We have our immediate ones, extended, and of course our community families. So first to think about what is the description of the patient's or your person's need, and what are their major problems that you're dealing with, that also you're having the most stress with, to identify that. And then identify who are the primary caregivers, and it might only be you, but identify that, but also who are the secondary caregivers. Are these your children, your spouse, cousins, whoever secondary caregivers possibly could be. And they also could be friends and church members. There are quite a few individuals that you have that I'm sure that you would consider some that would be social support, and they just need to be identified and possibly asked, and sometimes that's what I think is somewhat lacking, because we all as caregivers feel that we can handle it, but it's really important to tap into those individuals. Then identifying the community resources, and again you can those can be identified when you are tapping into some people who are experts in that area, whether it be social workers or again those persons in the support group who could to point you in that direction of what community resources are available in your area. And then really look at your financial picture as to where are your finances, what is available to you, and what are you looking at for that duration of this chronic disease. So making that assessment, again, brings some sense of control to a situation where you don't think you have any. When you've written it all down, identified what's available, it becomes a lot less stress. And then with that done, we need to develop a plan. It doesn't have to be a perfect plan, but we want to make it the best of what resources are available. So coming up with who will be these caregivers that will help out. If there's that unknown situation, as you as the primary caregiver, something might happen to you, then who will step in? Who will be available to do the care for your loved one? Once we develop that plan with all this information, we want to set a date to reconvene with the individuals involved and evaluate, do we need to change that, as there have been changes possibly with where we are in the trajectory of this disease. You want to make it always an option to call everyone together to help problem solve when you feel that the plan is not working, and come up with a different plan. Ultimately, on a personal level, you as a caregiver have to deal with yourself and your stress. As I mentioned in the beginning, that stress will take a toll, of course, on you in very negative ways, should we not. So I've talked about how to deal with your loved one's disease, but now as far as things that you can do for yourself. I give one other visual that seems to work, and that's, I'm sure many of you have been on a plane, and they tell you, the steward or stewardess tells you, okay, this oxygen might pop out, and make sure that you apply the oxygen mask to yourself first, and then apply it to your loved one sitting next to you. And that is what I want you to remember, that you have to take care of yourself. If you do not, then you will not be able to adequately take care of your loved ones. So remember that. So here are some things that we can do to reduce stress. First is to eat healthy. Healthy being including a lot of fruits and vegetables and water, and making sure you eat on a regular basis, not skipping meals, not foregoing a lot of the healthier choices. Second would be to exercise. Not only do we always promote exercise in our patients in general, we want to definitely use that one as a healthy way to reduce stress. Trying to make it part of your daily routine is usually the most effective. So involve, even if you need to involve your loved one in that exercise, which might be quite effective for them, but make sure that that's done on a daily basis. Also getting those regular checkups. I see pretty much on a daily basis caregivers attending to avoid their own checkups or making sure that they go see their doctor because they just are too busy providing all that care to their loved one. It's very important that you not miss that. Take a break from the caregiving itself. Make time to actually physically remove yourself from that caregiving. Identify in that assessment someone who could pick up for a period of time so that you can take that break, rejuvenate. Get a flu shot. I say that, as I mentioned in the beginning, where that we have that decreased immune system, so we want to protect as much as possible from becoming ill, so ensure that you do get that flu shot. Watch for signs of depression. Some of the signs that I mentioned at the beginning that would be involved, fatigue, problems with sleep, or changes in sleep, changes in appetite. Other signs of depression could be profound sadness, crying, loss of interest in things that you were interested in before. So watch for those signs of depression. Again, if those are noticed, make sure that you are going to your physician or provider in order to take care of that. Staying involved in hobbies, again, as I mentioned, not foregoing those things that were important to you and that also provided you an outlet for daily stress. So make sure that there is time allowed for you to be able to do that. And then laughter is always important. It's been shown for all sorts of chemical reasons and all sorts in your brain and immune system to be quite helpful. So always remember to laugh, to utilize that as a stress reducer. I end with the Serenity Prayer. I do this talk numerous times a year, and I can tell you all of the caregivers sitting around usually can quote this quickly before I even read it, so they're familiar with it. But it seems to be something that definitely they can relate to, and so I ask you to read along, to grant me the serenity to accept the things I cannot change, the courage to change the things I can, and wisdom to know the difference. Thank you all for attending today, and I hope that this information will be helpful for you in dealing with the stress.